It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: dog pregnancy, birth, and postpartum care. Just as humans require medical appointments during pregnancy, dogs also require veterinary care before, during, and after pregnancy. 1. Signs of pregnancy. For the first few weeks, you may not notice any changes in your dog's behavior. Some pregnant dogs will appear more tired, some will vomit, and some will eat less. You may notice that your dog is gaining weight and her mammary glands are becoming more prominent. In late pregnancy, many dogs exhibit nesting behavior, such as dragging blankets to a safe location and rearranging pillows. 2. How do I know if my dog is pregnant? Methods to confirm pregnancy include a canine pregnancy ultrasound, which should be performed around day 25 to 28 of pregnancy. Abdominal X-rays, which can be done on day 45. Blood tests are available to determine pregnancy, however, they are inaccurate and are not a valid method of determining pregnancy. Some veterinarians can also palpate, feel, a dog's abdomen to determine pregnancy, but this is also unreliable. Whether a dog is pregnant or not, her hormones after a heat cycle are remarkably similar. Because of these hormones, false pregnancy, or pseudopregnancy, allows non-pregnant dogs to show symptoms and changes in behavior. These changes are hormone-related and usually go away on their own with little or no medical intervention. 3. How long does a dog's pregnancy last? The length of a dog's pregnancy, or gestation period, is around 63 days from ovulation, or just over 2 months. Ovulation is determined by the control of the hormones progesterone and luteinizing hormone. Breeding veterinarians typically perform this test. By determining the day of ovulation, a veterinarian can specify a very precise due date to within 3 days. If the timing of ovulation is not done, a dog's ovulation date is largely unknown and the expected foaling date may range from 58 to 68 days after breeding. 4. What to feed pregnant dogs? Many pregnant dogs must transition to a high-calorie diet in the final weeks of their pregnancy, especially for dogs with large litters. Additionally, there are several high-quality, over-the-counter, veterinarian-recommended diets labeled for pregnant dogs, or canned food. Ask your veterinarian about the proper diet for your pregnant or lactating dog. Pregnant and lactating dogs should follow this high-calorie diet until weaning. It is important to note that puppy foods designed for large breeds are generally not recommended for pregnant and lactating dogs due to their different vitamin, mineral, and calorie content. Raw diets are not advised due to the high potential for infections that can lead to miscarriages or fetal compromise. 5. Postpartum care. These are the steps you should know for postpartum care, nutrition, and nursing. Keep your dog on a high-calorie diet. Your dog should be on a high-calorie diet, pregnant, while she is nursing her puppies. Make sure she has fresh food and water available at all times. Create a private space for your dog and puppies. You should keep the mother and her puppies in a clean, quiet area of the house with little traffic. If there is too much commotion around her, she may become stressed and neglect her puppies. Also, provide him with a safe space where he can rest away from her puppies while still having easy access to them. Newborn puppies should nurse every 1 to 2 hours, so your dog will likely be with them constantly for the first week or 2. If you think your dog is not producing milk or not letting puppies nurse, contact your veterinarian. Medications and vaccines should be avoided while your dog is lactating, nursing, unless approved by your veterinarian. Call your veterinarian if your dog seems sick. If your dog becomes sick, call your veterinarian immediately and let him or her know that she is nursing so she can prescribe safe medications if necessary. Likewise, if your dog stops eating, vomits or becomes very lethargic, weak and tired, or if you notice redness and swelling in any of her mammary glands, contact your veterinarian. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.